And hello, welcome to a panel discussion here of four various experts on various topics on the topic of preventing diabetic complications. And of course, this is Shealy-Sorin Wellness and the Real Holistic Doc. Wellness Wednesday coming to you, and lots of good people here. Introductions starting from this good friend, man right here, Jim. Do you want to say a couple of words about yourself?
Sure. Jim Amos. I'm an orthopedic surgeon. I spent my whole career, I'm retired now, spent my whole career in adult foot and ankle care. And
That
that's all you need to know.
You're going to know
Yeah.
some things
Treated a
about.
lot of diabetic.
Yeah, I was going to say you're going to know some things about diabetic complications with that. Yeah.
Indeed. No,
Yeah.
Rachel, hello.
Hello.
Yep, we've had you on the program before. A little bit about you.
Yeah,
Yeah.
so I'm the in-house. We say diet and lifestyle. A lot of it comes down to nutrition, but nutrition, thoughts, exercise, it's all connected, holistic. So
To me, it's more than that. To me, Rachel is well, she's going to be the key to this presentation as well because this is oh god, yes, off pressure of me onto you. But this is wonderful. Rachel is well. I'm just going to say. If you want to have a doctor on your side, there's a PhD, and there's right there. Your PhD is coming very soon.
yeah, should
Yes,
and before the end of the summer.
Before the end of summer. And the PhD is in reversing metabolic syndrome, which diabetes is a part of, but also cholesterol, hypertension, obesity, thyroid, weight gain, energy, everything. So Rachel is in the right place, doing the right things, and we're going to talk all about this, including some slides and presentation.
Yep.
Now, Dr. Shealy, Dr. Norm C. Shealy is, of course, well, he's my adopted dad. That's an aside. But for anyone who doesn't know, Dr. Shealy is the founder of Holistic Medicine, one of the founders. And you've been working with diabetes and diabetic neuropathy and all sorts of metabolic things for decades.
Yes.
Yes, sir. So we'll certainly take you up on your expertise. And if you ever want to jump in on something specific, please do.
Good.
So let's talk about what is diabetes and what is diabetic complications, just to kind of set the table. Speaking of the table, diabetes. Most people know it as blood sugar out of control. And that's a simple fact. What most people don't know, and we're going to get into this, is that it's a wonderfully complicated and wonderfully intricate combination of neurohormonal, including gastrointestinal system, endocrine system, thyroid. I think I may have mentioned hormones, which play a huge role in this, but also the stress cascade, autonomic nervous system, or this thing called stress, also known as hypothalamus, pituitary, adrenal axis, which results in cortisol release. And then, of course, we're talking about cortisol and DHEA, where you got one going up, the other balances it. The DHEA is the wellness. And Dr. Shealy, you've done a lot of work on DHEA, including four ways to naturally increase that.
Right.
And we'll talk about that if we have time. Today is a big topic. So it's a very big thing, and most people don't know, that it's not just measuring sugar and not just measuring the hemoglobin A1C, which is a 3-month average.
Yep.
But it's also about other factors, including base insulin and other things, and how that affects a lot of the other hormones, and literally everything, including metabolism, inflammation, and life and death.
So Dr.
Please.
Sorin, let's focus down for our audience this week, because we got so much we could write a dictionary, an encyclopedia or something.
And I would like to, but Rachel's here to rein us in.
Yes, you would.
Yes.
So let's focus on, so we know there's several different complications that come with diabetes, retinopathy, neuropathy, nephropathy, which is that's kidney, infection. We know that dental problems can come with that. So stay tuned. Next week, we will have a holistic dentist on our program. So that can be really informative for some of you guys. And of course, one of the really big ones is heart disease. So the three that we're going to focus on today that we kind of thought we would hone in on are neuropathy, infection, and heart disease. Because I think those are some big ones for people.
Yeah, let's actually,
Okay.
what I love about Rachel, by the way, is when I get into a topic, I just see the world of possibilities and I want to bring it all to you. And it's only 1 hour. So Rachel, thank you.
We do value our listeners' time as well as our time.
Yes, ma'am.
One statement, we're talking mainly about type 2 diabetes. correct?
Yes, thank you for the clarification.
Thank
So
you.
we are talking about type 2, not the autoimmune type 1 diabetic.
Complications.
So let's talk about the first thing to addressing diabetic complications is, of course, prevention. Because as Dr. Amos just clarified, this is type 2, which is a very preventable, essentially disease of the West. So some things you can do to prevent. And if we look at our second slide, we can see that it is really, really important to know your numbers. We don't have to look at that slide.
There we go.
Well, that's slide 1. Okay. So these are the numbers that we're talking about. As Dr. Sorin already mentioned, it's very, very helpful to understand your fasting insulin number. This can tell us about risk way ahead of any of these other ones. Hemoglobin A1C and then the TYG index. So if we go to the next slide, we can talk just a little bit about fasting insulin. And you can see insulin is a key regulator in blood glucose, essentially, I guess, metabolism, if we want to use that word. We have to have the insulin in order to open up the cell and put the glucose in there, right? So we can see if you have a high fasting insulin number, we can look years in advance and go, oh, you are likely to have type 2 diabetes. You're in the process. Way before we can see hemoglobin A1C. Your hemoglobin A1C may look just fine, but your fasting insulin may be through the roof. So this is a really nice one because it tells us lots and lots of time ahead, and we can get in front of it and start, working the other direction. So hemoglobin A1C, that's the next slide. Dr. Sorin was talking about that too. So we have some numbers. Anything under 5.7 is considered normal, 5.7 to 6.4. And this is where Dr. Shealy and Dr. Sorin always joke about the pre-diabetic. So I'll let you guys kind of give your opinion on that.
I'll just jump in briefly. And this is what I learned from Dr. Shealy. When I heard you say that, I was like, oh, God, I'm going to use that. Okay, so if a woman comes into my office and say, well, I'm just a little bit pregnant, doc. It's just nothing serious. When I'm about to deliver, then we'll talk. No, that's not how that works. Just like the pre-diabetes is on a range. You start with having a metabolic issue, metabolic problem, and it's not just diabetes, it's not just sugar, it's everything inside your body that's going in the wrong direction. So what I'm going to say is if you want to have a good pregnancy, make sure you address it from beginning. If you want to have a good metabolism and healthy and happy life, address it from beginning.
Yeah, so let's pop that slide back up big so our viewers can see that, because essentially what hemoglobin A1C is, it's an average over 3 months of the sugar that has attached to your hemoglobin A1C, so glycated proteins, which I like to tell people, so what you ate 2 months ago, it does matter. You think it doesn't matter, but your body has kept score.
Can't lie to your doctor on that one.
Right. Yeah, so we want people to know under 5.7, that's good. Anything above that, we start getting concerned. So that's another good indication. So know your numbers. And then this last one, so the next slide, this is the TYG index. I don't know, they may call it TIG index. I'm not sure, but I know what it is. So this is a really nice one because a lot of doctors aren't going to ask for a fasting insulin number, so you won't have it. They may or may not check the hemoglobin A1C depending on where they feel like your risk is. But when you do a panel, most doctors are going to check your fasting glucose and your fasting triglycerides. So you can plug these into the calculator, and this will tell you kind of your risk factor. So anything over 4.49, you probably are developing non-alcoholic fatty liver disease and or insulin resistance. So if you don't have the first two numbers to work with, use these two.
Absolutely. And I'm just going to jump in on this slightly different topic, so I'll stay away from too much focus on this. Non-alcoholic liver disease or fatty liver, take it seriously. That is literally a warning shot saying the most important resource to detoxify and keep you alive is failing. So just saying, if that's the case, address it seriously.
Yeah, a lot of people hear it and they go, okay, but
Mhm.
they feel okay. So there's not the overt symptoms of,
And the doctors in conventional medicine, pre-diabetes, oh, just wait until you're diabetic. Then we can consider some insulin terrible. And as well as, fatty liver, oh, yeah, it's just everybody's got that. Well, most people do, and it's terrible.
Yeah, that doesn't make it okay.
Well, they're typically not even going to talk about it when your numbers are well above 5.7. I mean,
Yeah, that is also true.
they're going to give you a pill, but
Yeah, actually, that is such a perfect segue. They will give you a pill, and we need to be worried about that. This is the other thing when we're trying to prevent or avoid diabetic complications is some of those medications will create a B12 deficiency. And so with a B12 deficiency, what happens is our myelin sheath on our nerves gets damaged, and then we can develop neuropathy. So you kind of got it coming at you at all angles. Is it neuropathy from the diabetes? Is it from the medication with the deficiency? Let's throw up that slide. I think that's slide number 6, so people can kind of see. So that's, you can see on the left, that's a healthy nerve. And you can see on the right, that's where the sheath is all damaged, and that can come from a B12 deficiency. So
the myelin, I mean, it's like the rubber coating or plastic coating over a wire. I mean, a wire is going to short out and have problems and not work properly, electrical wire. And that's what the myelin sheath is for.
and this is where your expertise comes in. Sorry, Dr. Sorin, go right
Absolutely.
ahead.
Thank you, Doc. I mean, you outlined it. And actually, feel free to jump in at any point. The diabetic neuropathy is literally, people describe it as electric shocks, pains down to the feet. And that's exactly what we described.
Mm-hmm.
So that's what it's all about. If we want to work with diabetic neuropathy, again, I might be jumping ahead of the game, but the best way not to have that situation is to take away the risk factors that led to this to begin with, period.
Absolutely. So let's talk about, what if you're already past that point? You have diabetes, you may have the complication like the foot issue. So if a diabetic patient were to come into you and say, hey, I just want to make sure that I don't develop this, other than the preventative pieces we've just told them, I know you have some things about like proper shoe fitting, like take us through the beginning. What would you tell them?
Well, I used to always tell them a story about, when we drive cars, old school cars had dials and told you the heat of the engine and variety of other oil pressure. The new ones have lights on them. And my car, I'm not a diabetic, my lights work. If they come on, I know to stop the car and look at whatever that problem is. If it's overheating or whatever, the water system in the car. A diabetic, if they have neuropathy, and only about 15% of type 2 diabetics have neuropathy, their lights may not work. I mean, they're driving along, and all of a sudden the hood starts having steam come out of it and the smoke and everything else. And all of a sudden the engine freezes up and they're in trouble. And the key is you've got to learn that whether you have neuropathy or not. And if you do, then you got to move to the next level of looking out for your foot, because your body is not going to give you feedback.
And so
period.
you have a little way to test for neuropathy that's pretty, like anyone could just do this at home, right?
Well, you can buy them pretty cheaply on Amazon, but it's called a Sims Weinstein monofilament. The one I remember, I used to have a whole set with like 10 of different ones. It's a logarithmic scale, but it has a little fishing. It's a little stick with a fishing line on the end of it of different stiffnesses. And the one that's 5.07, that's 5.07. When we test them, we would sit there and have you close your eyes, and we would test in different areas. Tell me when you feel it, and if they don't feel it, then they're in trouble. They got neuropathy.
Because I would just imagine a lot of people with neuropathy probably don't even know that they have it until you test
There's
it.
no way to know.
Right.
It's silent, except, as you were saying,
Yes.
a smaller percentage, a pretty small percentage, have painful neuropathy, and that's the worst. They can't feel, but at the same time, it hurts like HE double hockey stick.
Oh, God. Yeah, actually, interesting story. A friend of mine, actually, mutual friend of ours, Dr. Brian Daly, and he was on the program at some point. A wonderful gentleman, great guy. fellow physician, emergency room, and otherwise energy practitioner, diabetes, severe type 2, severe complications. One time we were traveling for a conference, he literally, and he had no pain. At that point, he didn't have much pain, I don't think. He went through a checkpoint security-wise on the way to a conference, forgot there's a watch in there, in the shoe, did not feel the watch whatsoever. And that led to the first of the many needs for surgical debridements and evaluations. And we'll get into it, but the PEMF device is what he says saved his foot and keeps saving it. I mean, there's things that can be done, but you're right. When you don't know, when you don't understand that there's a...
It's silent. You don't know. It's kind of like gaslighting. It just kind of goes away so slowly you don't know it's gone.
Subtle.
I had a patient one time who played a whole round of golf with his car. He got back to his car and couldn't find his car keys, and they were in the end of his shoe. And of course, that did some pretty serious damage.
I did do a slide, and maybe you can talking about the damage, and you can walk us through the progression. It's a very, very basic slide, but this is the next one.
Yeah, please do.
Here. I thought maybe you could walk us through that.
Yeah. So the key to these things are, and I think we're going to mention my video. I say it's my video. I produced it, but it was, I want to say 2005 or something, a long time ago.
We will, we'll put a link so people can click on it too. Yeah.
So basically, I'm glad you have this progression. I mean, these are stages, but this stage, I can't read it.
Yeah, no, it's hard to see.
Yeah, stage 5 doesn't occur as stage 5. It always starts at stage 0 and then goes to stage 1. And, you know, when they say, unfortunately, the docs will tell you, inspect your feet daily. What the heck are you looking for? You know, you got to tell people, you got to let them know what they're looking for. And in my video, it's very well done, is there's always a callus first. I mean, if I have a callus, if any one of us in this room has a callus and it's always in a weight-bearing area on a metatarsal head or something of that nature, if I get a callus, it's going to hurt. I'm going to complain about it.
Right.
And I'm going to file it down or have someone trim it down or get an orthotic that will relieve that area. A diabetic doesn't feel it. And they get a callus. It gets thicker, deeper, until it basically reaches bone, and then it sloughs off, and they've got, voila, an ulcer line under there. And I didn't know that was there. So if anyone out there is a type 2 diabetic and you've got neuropathy or you got calluses, take care of the calluses early on.
So when you say look at your feet, check your feet every night, you're looking for calluses to start with.
That and any kind of, then there's another problem. These are called malperforans ulcers when they become an ulcer. Then you can get Charcot-arthropathy or Charcot joint, and that's really bad. You look for swelling in your foot and so forth. And like we like to say, the pain, like a Charcot joint would be pain or not pain out of proportion. In other words, it's horrible looking on x-ray. It's massively swollen. And you ask them, how's your pain? It kind of aches occasionally. And I would absolutely be dying with that kind of pain. So again, the neuropathy gets you.
I consulted with a patient on the phone recently who has very advanced in half of his body. And I only thing I can do for pain control is the spinal cord stimulator.
The spinal cord stimulator at that point.
That was so. Just for the record, in your early career, you started in your invention streak, so to speak, through the dorsal cord stimulator, TENS unit, which are now all over the world, and now there's lots of other patents and inventions, but that's good to know. So how do you feel about this dorsal cord stimulators and TENS units for the people with diabetic neuropathy pain?
Well, it can be essential. I mean, I don't know anything else to control this man's pain. The spinal cord stimulator. It's injectable through a spinal tap.
Yep.
Thread. It's much simpler than it used to be.
Actually, there's a wonderful colleague of ours, Dr. Tonkin,
Yeah.
who actually he was here on the program with us
Yes.
and talking about this. So
Yeah,
check out that segment on Wellness Wednesday, please. Yeah.
Yeah. Unfortunately, he doesn't live near here.
Well, it's a little distance, but yeah, but that's wonderful.
I want to make one other quick comment.
Please.
Yeah.
Until probably a little more than a decade ago, certainly 2 decades ago, the common, the prevailing thought was that diabetic foot problems came from blood supply issues. And I'm just going to go out on the limb right here and say blood supply or arterial supply, perfusion of the foot in type 2 diabetics is pretty similar to normal people. I mean, it's not quite as good, but it has absolutely nothing to do with the foot and ankle problem.
And it's the neuropathy. Okay.
It's the neuropathy,
And so-
100%.
And to me that makes so much sense. And I get so frustrated that pain is always a bad thing in our world. I'm like, no, pain is an indicator. Pain is there to send us a message. It's communicating with us. I know people that will, this is a little off topic, but
Please,
they'll prophylactically take Advil, IV, or whatever their before they
Medications.
medication to avoid Well, I mean, I know runners that will
Good
take
point.
it to not have pain when they're running, and I'm thinking this makes no sense at all. Why are you pain is an indicator.
root
We
cause.
need it. Yes, root
Yeah.
cause. Thank you.
Yeah, this is where I go into the analogy world, and this is where the car analogy that you used is wonderful. I like the car analogies a lot. So let's say, would you rather have an indicator for a low tire before you get on the highway, or would you rather find out that you got a flat tire on the highway? I mean, that's just one way to look at it. Perhaps.
Yeah.
Yeah.
Yeah. So we're always trying to run away from pain, but
Yeah.
it's there for a reason. Yeah.
Yep. And anything else, Doc, that you wanted to? I mean, this is fascinating. Thank you, because a lot. This is actually. I'm going to say this blew my mind as well, because I grew up with a vascular concept of, and again, it didn't make any sense, but I got brainwashed in. When you said this, I'm like, oh God, brilliant. Now this kind of comes together. Thank you.
Yeah. The other thing I used to tell my patients is it's kind of treat your 2 diabetic feet with neuropathy are kind of like infants. You cannot not watch them constantly because they're gonna get in trouble. Or they're like a puppy in your house. Would you let a puppy run around free in your house? You've got to know what you're looking for. And the biggest one is calluses. And then I will say the other thing for Charcot arthropathy, a lot of theories out there about it. My theory is it's caused by calves being too tight and a bit of neuropathy. And so I would say with ease, if you can stretch your calves, don't start off gangbusters, go easy on it. But you're going to prevent a lot. 4 foot, I mean, it's well documented that 4-foot ulcers are greatly reduced, if not treated well, by just calf stretching or lengthening of the calf.
Okay, so then like to kind of just reiterate for our viewers, if you're wanting to avoid the complications and you have type 2 diabetes, I'm sorry. So you're going to stretching the calves is going to be a big thing, and then checking your feet
for calluses,
yeah.
especially
Okay.
not especially under bony prominences.
Okay.
Metatarsal heads.
Okay.
You heal sometimes, but
Okay, so those are the 2 big takeaways. I have another question, but
No, please.
so
Ladies first.
if somebody does come to you and they have not been doing that and now they're infected, what's the next step?
Good question.
well, I mean, you do what you can to determine, you treat them non-operatively. Sometimes we'll put them in a total contact cast. It's a cast that's just molded perfectly to them. If they're actually a lot of ulcers that look infected, they look ugly. They're not infected at all.
Okay,
And
so if
we
they
take a
can
knife
catch
and
it quick enough.
Yeah, we trim
okay,
them off. We trim
Okay.
them very aggressively. And by the way, it isn't going to hurt you.
Right,
'cause
you're not going to feel it.
But
Yeah.
we trim them off, and we're doing that not only to get rid of that callus that can continue that ulcer, but we want to look inside. We want to look and see
See
how
what's
deep
going
that thing is. And if it's, then we can run tests, sed rate, we can run an MRI can help. But we want to know where they are, and then sometimes it ends up with partial or below knee amputations that can lead to that.
Yeah, and that's what we're trying. We just really want people to avoid losing any limbs whatsoever. Yeah.
How important is a proper and right shoe?
Very important. So most ulcers are on the plantar part of the bottom of the
Bottom
foot,
of the foot.
but the side ulcers or toes and other areas. And what I used to tell my patients when they were trying on shoes was, and this is just my own method, is go to the store, try them on, and if they seem to fit, great. Wear them for about 20 or 30 minutes. You can't get a pressure decubitus ulcer without constant pressure for about 3 hours and 15 minutes. So don't wear them the first time for 5 hours. Go to work with them, okay?
Oh, right.
Put them on, wear them for 30, 40 minutes, take them off, and see if you see, when you see women who will cross their legs and then uncross them and they got that red spot on the top of the other leg, then you're looking for a red spot in some area of your foot. And if you've got that red spot, that may be the spot where you're going to start to get an ulcer.
So that's just not a good shoe for you then.
That's right.
Yeah. Okay.
Or get, professionally fitted. But I think in today's world, we have great non-custom shoes that people can get that are wide toe box.
Yeah. Okay.
Room.
Yeah, that makes sense.
Yeah.
Yeah.
Wonderful. Let's talk about some other common sense, simple things that people can do, because this is what it's all about, common sense. And of course, there's other organs that get damaged by diabetic complications, and especially neuropathy. And we're talking about, I just want to say that, we still have some time to talk. And at some point, I'd like to get to, for example, the kidney complications, or the brain complications, or, musculoskeletal. There's just literally everything every organ system that is affected, that we have in the body is affected, period. And that's because metabolism isn't just not working. And it's like literally having a car with a smoking engine compartment inside. And do you want to take a look and figure out where the smoke is coming from before it comes into the passenger compartment? And, you've got...
I would.
I think a lot of us would rather, again, prevention is key. So you mentioned several different things that could kidneys and all of that. So let's talk about the big one we had mentioned today. So the foot, that was really important. Let's also talk about heart disease. I know we have a slide for that, I'm pretty sure. So medial calcification occurs preferentially in diabetic patients with neuropathy. So you see how it's all kind of goes together. And that's a strong predictor of cardiovascular mortality. So I don't know if you want to throw.
Absolutely.
Okay.
And if you look at the vessels, if you're looking at the blood vessels, you're looking at vessels all over the body. So let's say if I talk to a patient or a client who has, let's say, cardiac heart, heart-related vascular issues, guess what? The same thing is going to be in the legs, arms, kidney, lung, GI, everything. So you have to look at the body as a big picture. In other words, if there's a smaller pattern going on, what I do as a functional, holistic, regenerative doc, I'm not sure how I came about to be this way, but what I've learned to zoom out and look at the picture of the body in a way that, okay, let's say hormones are off. Let's say thyroid is off. Let's say somebody's gastrointestinal is off, or depression, anxiety, some kind of a mental health or cardiac, vascular. The way that I literally look at this is, first of all, of course, it's good to identify. Is there evidence of heart disease? Boom, that's one thing. Is how is the overall function? And then of course this is why we do proper functional holistic testing, and that includes a panel that includes entirety of the hormonal, thyroid, insulin.
So let's name, so people know the test. You can test to see your calcification.
So there's actually a cardiac calcium CAT scan. In other words, to check for the cardiac score. Now, it tells you what the calcification is. It doesn't tell you if there's going to be an event with, say, a thrombus going. It doesn't protect you against that if a person is at risk. But you've been using this for a long time, Dad.
Well, two things are important. First of all, bypass surgery. There are 200,000 people a year in this country with bypass surgery, but 2 million with an aortic stent. It's same thing.
Mm-hmm.
It's so an elevated calcium score may mean simple hypertension.
Boom.
Right.
But
Yeah.
if it gets into real trouble, you are a patient for bypass surgery or a calcium score.
And we want to bypass the bypass.
Yeah.
Let's talk about that. Bypass the bypass surgery. Now that came from you. That was something.
And Angela God gave to me.
Yes. Let's talk about that. Bypass the bypass surgery. And
Yes. Well, he just suddenly, out of the blue, brought it up. And he said, to prevent it, you need to wear a pendant or something over your heart that has
crushed sapphire.
crushed sapphire or pellets of sapphire.
Yeah.
And both of us had that done, and it decreased 200 points a year.
Yes, sir.
So we're about to do 8 more patients to prove it. It's important because it's
This is for your research. You're doing this for the patient.
Research
Okay.
with Missouri State University.
Yes.
Focusing on whether wearing a pouch, with sapphire, will actually reduce the cardiac calcium score. And there's already some evidence, that from earlier
evidence. And also,
Mhm.
for people with simple hypertension,
simple hypertension.
Mhm.
Yeah.
you can reduce blood pressure just by wearing the calcium score.
I was we were cleaning out some files the other day, and I saw it was a letter from a patient that you had recommended do chelation therapy,
Yes.
and they, I guess, had wonderful results with reducing their.
Yes.
There-
Chelation is important for that.
So let's talk about chelation. I'd like to jump into that because
So
this
it's
is
a couple different tools. So there's
Couple of different
sapphire, there's chelation, there's
I love chelation. I'm doing that personally now, by the way, Doc, there's already a number of sessions. And my goal is to get to about 30 sessions. Why am I doing chelation personally? First of all, my cardiac score is not 0. So I want it to get to be 0. I want to be like as healthy as a newborn baby, basically. That's number one. Second of all, I was surprised when I did the heavy metal testing for myself that I had a whole bunch of lead, arsenic, cadmium, and there's a bunch of others that.
So let me say something. This makes a lot of sense because chelation therapy, actually, the way they kind of discovered that it was great for cardiac was Dr. Norman Clark was treating patients with lead poisoning, and he noticed that they all had improved cardiac symptoms,
including blood pressure,
Yeah.
heart disease, mortality, morbidity.
So the mechanism of action is still a little unclear on how. There's a couple different theories, but you can see that.
Well, actually, the short of it, the metals are the poisons. You got different poisons, organophosphates such as glyphosate. Was basically in all of the grains, pretty much. But there's also heavy metals, and metals they interfere with ATP production, interfere with the cellular production, cellular machinery, communications, immune system. And so the next thing you know, if the body is not working, it's going to go. It's like a car that basically is going into a default mode. It's still going to do something, but it's not good. So this is that's.
Yeah. So I mean, so again, like we were just saying, there's several different tools you can use, but there are tools.
One of my favorite agents is it's called EDTA.
Yes, and
this
that's
is
for chelation. Yeah.
For chelation. Thank you. I'm excited about this. This is one of those topics. Because I love the idea of just taking something that is supposed to be progressive and worsening, like in heart disease. Like I'm gonna ask. There's 4 doctors here, literally. How often in our professions do we hear that you can reverse heart disease? We don't hear about that.
No.
I'm not even sure you're allowed to say that.
Okay, I'm not allowed to say that.
I don't know.
Okay, may help. Okay, I apologize. I broke my own first cardinal rule almost. May help to reverse heart disease. But the concept and the idea is if you have a binding agent, something that basically will take a bunch of bad stuff, including calcifications where they don't belong, and also bind a bunch of metals that are floating around and either poisons and things. It's an inert molecule, and then you get rid of the bad stuff from your body. And so it should be, to me, it's no surprise that there's so much research and evidence supporting that. Yet in our culture, in our medical system, that's not something that
It's funny that in my training a million years ago that EDTA was for when you had, lead poisoning or something.
Yes, sir.
That one particular metal that was too high and it was killing you, and they would put you in the hospital and chelate with the EDTA, and it's like a lot of things. They've taken it from these severe cases to now they're using it for just common everyday. Let's use it for something that can help someone in a lower level, at an earlier stage.
Yeah, and again, earlier
I didn't
stage.
know that.
That's the key.
Absolutely.
Yeah.
And the crazy thing about chelation, and I can talk about this for a long, long time, but the sicker you are, the more complications you have, the worse your arteries look. Diabetics, hypertensives, cholesterol, endocrine, people who are basically the sickest. They're the ones that get the most benefit. Not a surprise. Not a surprise. Is there a benefit to people who are generally healthy and want to prevent things? Well, if you can prevent an ongoing and keep it from becoming severe, hey, that's it.
Mm-hmm.
I mean, it's not unlike eating healthy. I mean,
Well, yeah, and I was actually thinking we kind of didn't address that big elephant in the room.
Let's do that. Let's go to the basics. Yes.
you're on.
Yeah. So
Yeah.
I mean, and you can sum it up in just a few words. I'm like, eat healthy, exercise. What does eat healthy mean? You can go all these different ways, but one of the things that I like to reference a lot is Weston A. Price. He was a dentist that went and studied several cultures, and what he found was the commonality was it didn't matter if they were high carb, high fat, high protein. The thing that made everybody healthy was they were not eating Western food, so they were not eating processed foods, and that, I mean. When by the time you've developed a condition, then maybe we need to be more specific. But if you're starting base level, that's the fundamental. Stay away from the processed foods, and you won't develop all the issues to where we have to start tailoring the food.
And I'm on LinkedIn occasionally, and I follow these guys that do kind of what you do, and they're always talking about longevity. And I always jump in and say, I don't care about longevity. I don't care if I die 4 months from now. I just want to feel good while I'm here.
Quality.
Yeah, it's quality of life, not quantity.
Doc, I will.
Yeah.
I mean,
Yeah.
so there's,
Yeah.
but the problem is people feel bad chronically.
So they don't
But
even know what it's like to.
By
feel
God,
good.
I'm alive, and I'm here. And
We can prop you up.
Yeah.
Yeah.
I think that's a much better goal to have when it comes to eating healthy than longevity, even getting sick. I mean, long before you get sick, just feel better.
Yeah. And I think the whole thing is focus on the quality. And if you focus on the quality, the longevity piece will naturally follow.
It has
Yeah.
to. It absolutely has
Yeah.
to.
I mean, look at Dr. Shealy over here. He's almost 91. You'll be 91 this year.
Well,
Yeah.
actually 92 this year.
Oh, okay.
Remember? Yeah. You're already 91, aren't you?
Yeah.
All right. Well, see.
Wow. So, yeah, absolutely. Now, one other thing that I want to mention, and this goes back a couple of years, PEMF and diabetic neuropathy. You want to talk about that a little bit?
Well, it's good for many things that are out of balance. Even carpal tunnel syndrome, it helps control that.
Mm-hmm.
And it helps heart disease. It helps the mind above everything else. And you have 3 different varieties.
Modes, yeah.
Yeah, delta frequency, a chakra sweep frequency, and gamma frequency. and each of those has a particular use. Delta is for sleep or
Relaxation.
pain.
Mhm.
Gamma is for everything. It's
Brain
just-
optimization,
just think.
how I describe it.
Yes.
Yeah.
And this
The sweep
chakra
is, yeah, that's the Schumann frequency. That's basically, it's literally the heartbeat of the earth and the key to cellular health, energy production, recharging cells. Now, one thing that you told me very early on is how you discovered that the benefit of PEMF on diabetics is that you had one of the diabetics put the ring on the feet, and then all of a sudden the person said their feet feel like dancing, and this is a person who didn't have any feeling or sensation. Do you remember that's?
yes,
Yeah, that was an interesting finding, right?
indeed.
And I think we should set the expectation that will happen for some people. Some people, the PEMF is a slower, you have to use it and see changes over time. So occasionally we'll get phone calls,
Okay.
where they're like, I've used this for 2 days. Well, give it some time. You didn't get in your condition in 2 days. We're not going to get you out of your condition in 2 days. So
Yeah, one thing that Dr. Brian Daly talks about, and I would love to have him back on the program.
Yeah,
He's a
absolutely.
fascinating gentleman, and he's breadth of knowledge. I mean, just my God, yeah. So he had, unfortunately, with his diabetes, and that's probably one of his biggest follies in terms of health. Otherwise, he's mental, emotional, spiritual. He's just right there. That's how he recovers after everything that he's been through. But he literally went almost for multiple surgeries, multiple revisions related to diabetes. And I believe there's a number of factors contributing to that. And he's doing much better from what I understand. Without PEMF, he would have lost both his feet. This is what he told me. And the other interesting thing that he mentioned is that with the device, he was talking to the surgeons and podiatrists. They were saying, you've got to be incredibly in pain right here. And when the ring is on, he said, no, I'm actually okay. There was one time that there was an emergency. I shipped out my own personal one to him because there was something had to be replaced, and he was going for pre-surgical. He was literally in a place. He's like, I need it. But there's so many things. The number one thing I would say, other than electromagnetic, of course, is just mindfulness and awareness. And I just want to come back to the concept and the idea that if you don't have diabetes to begin with, you will not have diabetic complications. Can we come back to that?
Yes, I'm glad we looped back to that, because that is exactly where we want people to be. Let's be preventative. We do have a few questions I think we probably need to address.
Yes, please.
Let's see what we've got.
Okay, let's see. I was told by my father's neuropathy doctor, said he wanted to see his children's legs. He said I had it because I had thin legs. Can this
be an indication?
An indication. I have no issues, no calluses, very healthy lifestyle. Jim, do you want to jump in?
Makes no sense to me.
No,
No,
it does not.
I've never heard of that.
Yep, Dr.
Doesn't mean
Shealy.
it doesn't exist. I mean, I just. not
Yeah, you're
personally.
just saying that's not a
Yep.
theory we've ever.
Yep,
Yeah.
Rachel.
Yeah.
No.
Yeah.
Okay. Yep. That's. Yeah. Sorry. Doesn't make sense on that level. Yeah. Dr. Sorin will be very interested in Katsu for exercise, blood restrictive flow device used in Japan for decades, with
right.
many benefits besides bodybuilding. Oof,
You know what that is?
You got my attention.
They put basically a tourniquet on their arm
Mm.
or their leg,
Yeah.
and they work out with that. And it has to be at the exact right pressure. And apparently you build muscle a lot quicker, and not only just for this arm. If you put it on this arm and work out your legs, it also helps the legs. It doesn't have to be on every
I've
extremity.
seen that in the bodybuilding world.
Yeah.
Yeah.
No, it's big.
Okay,
It's
yeah.
gotten bigger and bigger.
Okay.
I love that, and thank you. So that's my next project. I'll be looking into that. Thank you.
They're not cheap, but if
If you're serious, it's
yeah, I mean,
yeah, that's wonderful. It's wonderful. Thank you. I appreciate that. Is oral EDTA effective? And if so, better taken between meals. Definitely between meals. Is oral EDTA effective? Now, we do have something in the office for people who cannot have intravenous. Intravenous to me is a gold standard.
Okay, so if you have an option,
Do the
intravenous is going to be
intravenous.
better.
Absolutely. Okay. And the concept there is you go through 30 IVs. That's a standard just before you can see significant change. You could see change before, depending on where you are. But I always say, if you're doing 30 treatments and you're seeing something great, if you don't see, again, it's significant heart disease, give it more time. Again, but sometimes it's 30, 60, 90 sessions. The idea is each session is going to take you closer. And it's a wonderful, direct way to get the binding agent into the bloodstream and out. There is something called Chelax, which is an oral chelation. And we've used that for a while. Again, it's good when you don't have any other options. In other words, it works, it does well. It comes from one of the founders that you know well personally, and we had a good conversation. So if you do nothing else, certainly an option. You can give us a call at the office, and we certainly carry that product. It's best to be evaluated, seen, and to know where you are, and then to have before and after, just so you know what works. Because if you do something over and over again without evaluating results, you don't know where you are. You don't know if it's working. Yeah.
I always feel like it's good to have metrics so you can, because when change starts, when it comes from the inside out, we as humans get impatient and we want to see the outside change before letting the inside change. So it's always nice to have that kind of metric that says, no, look, you're on the right track. This is working. Yeah. Stay the course. Or if it's not working, then we need to know.
And by the way, one of the things that I love about what you do, I love it. I truly do, and you're my coach. I'm going to say, just making it very clear. After my back, my car accident, blowout fracture of L3, and I pretty much lost all my butt muscles. And the legs. I could walk, but Rachel came on board. Thank you. I'm back in martial arts. I'm loving it. I'm doing other things.
Awesome. I love it.
Yeah. This is what you do. Accountability and responsibility. And I am famous for being as vague as I can possibly be when I'm working with my own personal health. What do I want to do?
I know.
What are my goals?
What are your goals?
Boom.
Can I tell him your workout goal? Okay.
Please.
This is what he tells me.
Yeah.
Let's get some metrics. Let's measure our progress. Let's see where you want to be. Set some goals. I want to be like a cat. How do you measure
like a big cat? Just powerful, flexible. But okay, where's the metrics, right?
Yeah, I need a little more concrete, goal setting.
It's funny, I want to be like a dog.
Oh, good. Rachel, I'm not going to ask you what your goals are.
Yeah, no, I haven't picked an animal. Maybe I need to.
But your goals are metrics oriented, and
I like measuring.
And that's what got me the results, because my goals did not give me the results, obviously, So
it's good. It's good. Gotta have someone that actually will make you measure a few things. Keep track.
Along those same lines, when I had patients recovering from surgery, and I don't know if this is helpful, but you're talking about goals, meaning the testing they're having done, but external goals are the ones they see. I used to tell patients, they come in and they go, 4 weeks after surgery or 6 weeks, I'm not a bit better. Well, what are you doing? Well, what were you doing 2 weeks ago? I was sitting on the sofa doing nothing. What are you doing now? Well, I went out and ran 3 miles yesterday.
How quickly we forget.
I think you're better. But I would tell them, that's a really gross example, but I would tell them, keep a little journal. Write down week 1, this is where I am. And when you're kind of depressed at the end of week 2, look back at week 1 and see how far you come.
That is wonderful advice.
And that's
great. For anything place you're trying to measure progress. Yeah. Mm-hmm.
Even if you're trying to be a cat.
Well, if it is what it is. Yeah. Right. Right. But what I just want to clarify. What I like about the cat world is that cats are flexible. They always land on their feet. It's in general. They enjoy their life.
I'm gonna have to get specific with you. Metaphoric goals and literal goals.
Yes. Yeah. See, that's and that is exactly where Rachel brings it in, because, and again, when I have clients in the office, I'm gonna say the same thing. this is an interesting segue here. What do you want to achieve? I want to feel better. Okay, what does that mean? Let's get into this. And then it becomes a question. Okay, what does better mean to you?
Right.
Does it mean more quality time with family? Does it mean more functional time? Does it mean capacity to focus? To be more, well, whatever it is.
Yep.
Yeah.
And we do probably need to take a moment for our sponsors. So.
Oh, yes, thank you. Yes.
Yes, if you live in the Springfield area, there's only one health food store, Spring Valley. It's where I shop, but their value is service. You walk in this place and you 10,000
items.
You can't find them, but they find them for you. So if Spring Valley is the one for sure. And
Coloma.
Yes. Has
tart cherry juice concentrate.
Cherry juice concentrate, the only place in town.
Over 30 years for you, right?
30 years.
Yeah, that's antioxidants, does really well. Tastes good. Actually, you got me into this. So I mean, hey, that's wonderful. So yeah, check it out. Very healthy, good living, and of course, we encourage your veggies as well. Make sure you get your veggies, you get your basics. Rachel, let's get to a little bit more nuts and bolts since we have a little time, a few more minutes. So within the next 5-6 minutes, let's cover the basic lifestyle and essential things, perhaps in a more broader form, because at some point I want to get into it.
Yeah.
What do diabetics need to know?
Well, and we had a really interesting guest a couple of weeks ago, who was a type 1 diabetic.
Thank you.
Who had figured out now a very strict lifestyle, but how to control his type 1 diabetes without insulin. And a lot of those principles can be applied to any and all of us, especially including type 2 diabetics. So one of the big things was exercise, and he was like, just the standard 30 minutes a day of cardiovascular, 5 days a week. What we find is if you don't have those problems, you can get away with a lot less, but you still need to exercise. So do what you can. And if that's starting with 5 minutes a day, that's absolutely fine. And then of course, if you are a type 2 diabetic, there may be specific foods that aren't good for you. People will say, well, this is a wonderful food. It is. I eat things like bananas and grapes and I love them and they're delicious. They're not for everybody in their journey at a specific point. And so this is why it's always really good to work with someone so what is this doing? What is this food doing for you right now in your journey? Because again, those aren't bad foods. They may not be a good fit for you because you've gone down the path too far and too long with the processed foods. And so now we have to back off of a lot of different foods. But again, the fundamental is before you ever get there, if you can just live a lifestyle, really minimal processed foods, plenty of exercise, you'll avoid all of these problems anyway. So
the other thing that you pay very careful attention to is the GI tract.
I do.
And this is actually Rachel is literally she's our doctor, and I say doctor now because in my mind she's already a doctor, even though the project is almost done.
Yeah, almost.
The concept of taking metabolism and reversing it.
Yeah.
Brilliant.
Yeah. Well, so reversing metabolic syndrome is essentially getting ahead of type 2 diabetes. It means you're on the path, and we're gonna send you back the other way. So yeah, and I have some pretty good data now that says what we do works. So it's exciting.
Wonderful.
Yeah.
So, and when I was growing up in medicine, and please feel free to jump in, gentlemen, because I mean you've been through the medical system as well. Rachel, you've heard plenty about medical system.
Yeah. I'll just hear your stories.
How when you were growing up, so to speak, or when you were learning or being taught about what diabetics. Was there ever a statement or hope that things are reversible or things don't have to be? In other words, it's always progressive. Things are always going to get worse, and there's nothing we can do. Isn't that? Is that what you were trained in? Because that's what I was trained in.
100%.
Don't have sugar in the house.
Yes.
That's how we grew up. We did not have sugar in our house.
Yeah. So I just
And
want
a day with Cheerios was a, ooh.
Oh, God. So I say this for a simple reason. If you're talking to somebody wearing this, a white coat, and if it's not me, and if you hear something, well, there's nothing you can do, nothing we can do. Just want to say that's not correct.
Well, and
That's not correct.
Yes, and I think that a lot of patients
Yeah.
that come to us have learned that they have to be their own best
Oh,
advocate.
yeah, absolutely.
Yeah.
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 So if I were to just give an essential summary, first of all, diabetic complications. The first concept is, and I think we're on the same page here, don't get diabetes if you don't have to. And the way not to get diabetes is by talking to Rachel.
And also, I just want to throw in too,
Yes.
a lot of people say it's genetic. And I'm like, you may be genetically predisposed, but it doesn't mean it has to happen. We can turn on and off our genes. We can silence them or we can express them based on what the choices of we make in our environment. And that includes food, exercise, thoughts, all of the things. Yeah.
The next level, besides beyond the basics, which is exercise, nutrition, lifestyle, attitude, huge factor. Emotions, feelings, depression, anxiety plays a huge role in this, and so is the opposite. The next place for me in the proper management of diabetes and its complications is just general diabetes is functional holistic medicine, addressing the hormones, addressing the thyroid, the GI tract, which we do together with Rachel, and of course, if you have a provider who does that, properly on their own, that's wonderful. But also addressing the immune system and the autonomic nervous system, sympathetic, parasympathetic, fight or flight, in other words, which is also known as stress. So that's what I focus on as a physician at this point. Please.
I don't want to belittle your efforts.
No, please.
But it's this strong of an argument. If Rachel could get a hold of you first early
you don't
on,
need me.
You'd never exist.
I don't want you to need me.
Yeah.
Folks, I don't want you to need my services. I don't want you to need the functional labs and testing. I don't want you to need, well, Jim, when it comes to specialists such as, operations and, working on the wounds.
You really wouldn't need me.
Oh. But it's good to have, when something happens, because if you're in trouble, guess what? Working on reducing hemoglobin A1C is not going to stop an infected wound. So you got to go see Jim, someone like Jim, and you got to catch that early.
But in a perfect world, we would all be preventing it by doing the right things from day one.
Yeah, and I do have people come to me that say, I want to eat healthy. I don't know how.
I will say one thing. There's a big myth out there that you can't eat. Unhealthy eating is cheaper. And that is absolutely and unequivocally untrue. Healthy eating is actually cheaper.
It's just more time. You're gonna put the opportunity cost into the time, but you're worth it. And if you don't put the time in up front, you'll put it the back end being sick. So yeah.
Then you'll find the time.
And that's right. You sure will. Yeah. Yeah.
Amen.
Thank you for pointing that out.
What's the old line? Yeah. Never enough time to do it right the first time, but there's always enough time to do it over.
Amen. Yeah. Amen to that. And so let's kind of roundabout, I should say, unless there's any comments or questions or thoughts, happy to address those. Concept of holism, spirit, soul, mind, body, coming right from the expert. Okay, who are we? Spirit, soul, energy. I don't have to believe. I know I had a near-death experience personally. Again, this is my experience. This is what I experienced. Dr. Shealy, you've been through a number of wonderful, interesting things. So the fact of the matter is, what I'm getting to is most people don't realize the control center, thoughts, feelings, emotions, attitudes, perceptions. That's up to us.
Train your brain.
Thank you. And that is as big of a factor in diabetes and in everything, in wellness and in life as it gets. And then, of course, it gets into the what I call the body, physical. And this is where primary prevention, what it should be, is Rachel. Secondary prevention is what I would say is where I am. Because this is where you get into
And then if you have to go see Dr. Amos, I'm just
kidding. You're up a river without a paddle, or maybe one paddle.
Yeah. So let's just want to summarize and just any final thoughts because we're almost out of time. Ladies first, I guess.
Yeah, no, I think we've
Yeah.
covered it. I think you guys all had some really excellent points, and hopefully that helps a few people.
Wonderful. Jim,
Be proactive, not reactive.
Love
Right.
it. Yeah.
Dr. Shealy?
Every thought is a prayer. Think health.
There you go. Perfect.
And we will see you next Wednesday, Wellness Wednesday. Jim, this is not the last time that you're here on the program. You are incredible. Thank you. Rachel, as well, great to
Thank
have you. Dad, you started this program, so let's reconnect next week. Another wonderful topic. And if I'm not mistaken, it's going to be on
Holistic dentistry.
holistic dentistry. And that's a big, big field and needs to be explored properly.